All right, welcome back. Our absolute favorite dentist of all times, Brian Dunlap, is here with us. And Brian, each and every week we come up with new dental scenarios that folks need to know about. This week we're talking about emergencies, whether you get a chipped tooth or you think you've got a crack and some horrible pain going through your gums. What are we supposed to do?
Bad stuff. We're talking about bad stuff today. You know, mostly kind of things like accidents. You know, most of our accidents you'll see are kids. You know, unfortunately, we see it so often. Kids, front teeth, they fall, can't get their hands in front of them, hit the floor, hit a bar or something with their teeth. And so that's one of the things that we see more often than anything. If it's baby teeth, obviously it's not a huge concern. But once you get to be about 6 or 7 and they get their adult teeth, that's when we see problems.
So let's go through the scenario again, because I've got a child on the way. She's going to come out. She's going to be a little bobblehead. She's going to fall. She's going to crack a tooth. What do I do?
Well, first of all, you know, a lot of times, fortunately, if they're real small, like yours is going to be early on, they'll hit their lips and face, but a lot of times we don't get a whole lot of tooth damage, thank goodness. But, okay, let's say that you chip a tooth or break a tooth. Obviously, the first thing you need to do, pretty obvious stuff, go to your dentist. Yeah. And, you know, depending on the scenario is what we would do. If it's a very small little chip on a child, usually it's not a problem. You smooth it up, make sure it's not sharp, and they won't have any big problems. Big issue, they knock a tooth out, then we need to kind of figure out what we need to do and possibly maintain a space when the adult tooth comes in, everything's properly aligned and everything.
Finally, when we're talking about mouth pain, we can't really just push it to the back of our mind and not think about it, right?
We keep bringing this up, and I'll tell you why. It's because more and more lately, for some reason, I've been seeing in my office a lot of people that come in with mouth pain and they've had it for a long time. Yeah. And it's become chronic. And the scary thing is we've actually had a couple of people that have ended up in the hospital with this, because when you have a pain, it's almost always indicative of an infection. And if you've got an infection in your jaw or in your head, it is very dangerous, because that infection can spread to your brain, it can spread down into your neck and some very vital areas of your body. And it just becomes very, very scary. And so, you know, we keep bringing this up, folks. If you have dental pain, please don't ignore it. Please go see a dentist.
I've heard a rumor.
Oh, God.
I'm just saying, this is actually not your balloon. This is Greg D's balloon, but it's Greg's birthday as well. Oh, okay. But it's also this boy's birthday. Happy birthday, 28. Dr. Dunlap.
Thank you very much.
28 again? You got to catch up to me. Quickly, how can folks get in touch with you at Dunlap Dentistry?
Oh, well, our phone number's online and in the book. You know, we also have a website that you can go check out if you need any information. All this information is always on our website. Please, guys, just go see a dentist if you're in pain.
There you go. All right, we're going to dial for dollars coming up, but don't forget to say happy birthday to Dr. Dunlap and Greg D.
Brutal.